is threatening to emerge as the next pandemic. At current count, over 40,000 cases and 600 deaths have been reported in China and over 300 cases in 25 other countries. Unofficial modeling studies by a number of institutions claim infections of over 150,000. The alarming speed of transmission is in part because the virus spreads through the air and by touch.
SARS-CoV-2, the virus that causes the novel coronavirus COVID-19. A single cell is just 120 nanometers in diameter. Here it is at 12 million times magnification, a microscopic virus that's turned the world upside down. Each cell of the virus is made up of several parts. On the outside, it's covered in nodules topped with distinctive protein spikes. It's these spikes that give the coronavirus family its name. In Latin, corona means crown, see? And the name COVID-19 simply means coronavirus disease of 2019. The corona protrudes from the glycoprotein membrane, an envelope of lipid molecules that coat the virus cell's body. This fatty layer of skin is very delicate and it falls apart when it meets soap. And that's why, for now, soap is our best weapon against the virus and why you should take your time washing your hands. After 20 seconds, soap penetrates the grease and grime on our hands enough to rip the virus membrane apart, killing it. Under that oily skin is where the real trouble lies. Inside each cell is a small sample of RNA, ribonucleic acid. It carries the virus's genetic code and allows it to multiply, leading to infection.
To angiotensin-converting enzyme 2 receptors on the cell membrane, allowing the virus entry. The exact mechanism for this is not known. Most likely, as shown here, the human cell ingests the virus in a process known as endocytosis. Once inside the cytoplasm, the endosome opens to reveal the virus's genetic material, a single-stranded RNA. The virus hijacks the cell's machinery to replicate the RNA in N proteins and uses the endoplasmic reticulum to form its M protein outer layer and the all-important S protein. After replication, the virus is carried by the Golgi bodies out of the cell in a process known as exocytosis, so that it can infect other cells. Meanwhile, the stress of viral production on the endoplasmic reticulum eventually leads to apoptosis, or cell death. It should be noted that the mechanism of action for 2019 novel coronavirus is unknown.
Develop fevers early on. The World Health Organization China Joint Mission saw that about 88% of people who had COVID-19 had a fever. Another study out of China showed that while only 44% of patients had a fever on admission to a hospital, 89% eventually developed one. But there have been some cases that led with gastrointestinal symptoms. Diarrhea, nausea, vomiting, and/or abdominal discomfort may appear a couple of days before respiratory symptoms. This isn't the norm, though, because COVID-19 cough is one of the most common symptoms. Same goes for shortness of breath and phlegm production. Other symptoms that can appear around this time are fatigue, sore throat, headache, joint or muscle pain, chills, and a runny nose. By day 5, patients with pre-existing conditions might find that they have trouble breathing, and it usually takes about 7 days for a person to go to a hospital. Mild cases, though, usually clear up by this time. But those with moderate to critical cases will have developed pneumonia, which can range from non-life-threatening to severe. Recovery time for these patients could be anywhere from a few days to weeks. For some severe and critical cases, though, symptoms can escalate into acute respiratory distress syndrome. ARDS is an illness that happens when fluid builds up in the lungs. Inflammation triggers a flood of immune cells that are meant to target the infection. They're usually isolated to infected areas, but sometimes the body goes overboard, which is when the immune cells start killing anything in their path, including healthy cells. ARDS is often fatal. In critical cases, it can lead to respiratory failure, requiring advanced life support. and this is most likely when patients head to the ICU. ARDS treatment includes supplemental oxygen and mechanical ventilation. The goal is to get more oxygen into the bloodstream, since the lungs can't. When this treatment doesn't work, the lungs are basically too flooded to get any oxygen into your bloodstream. That's the cause of most COVID-19 deaths. And even when a patient survives this phase, they could be left with permanent lung damage. SARS punched holes in some infected people's lungs, giving them a honeycomb effect. And these lesions have been seen in people affected by the novel coronavirus too.
One, stay home. 2, monitor your symptoms carefully. If they worsen, call your healthcare provider. 3, rest and stay hydrated. 4, if you have a medical appointment, call ahead and let them know you may have COVID-19. 5, if your symptoms are severe, call 911. 6, cover your cough and sneezes. 7, wash your hands often. 8, stay away from others in your home. Use a separate bathroom. 9, avoid sharing personal items. And 10, clean all surfaces that are touched often.
Myth number 1, lemon juice protects you from COVID-19. There have been plenty of claims about things you should eat or drink to thwart coronavirus, and the lemon juice myth just won't go away. It started with a viral social media post containing advice from a fake Chinese scientist. To be clear, lemon juice is obviously not bad for you. In fact, all fruit and vegetables are essential, while nearly all of us have to stay at home. They can help keep you healthy, but they don't stop you getting a virus like this. Myth number 2, mosquito bites can infect you with the virus. We all know you can get other diseases from mosquito bites, but there's no evidence at all that the little brutes can infect you with coronavirus. Again, remember, this is a respiratory virus spread mainly when someone who is ill coughs or sneezes. And the best way to protect yourself is to avoid close contact with anyone who is sick and keep washing your hands. Myth number 3, blood donations will get you a free test. Some people are hoping they might get a free coronavirus test if they donate blood. That's absolutely not the case, but there's been a persistent false belief on social media that it might be. To be clear, you don't get tested for COVID-19 if you give blood. And the last thing staff who... Myth number 1, holding your breath. If you can hold your breath for more than 10 seconds without discomfort, one widely shared claim asserts there is no fibrosis or scarring in the lungs and basically no infection. Nope. Holding your breath is not a test for fibrosis, and fibrosis is not a symptom of COVID-19. The main symptoms, don't forget, are high fever and a persistent dry cough. Myth number 2, homemade hand sanitizer recipes. Beware internet solutions for homemade sanitizer. Anything based on disinfectants for cleaning surfaces probably won't be suitable for use on the skin. As for suggestions that vodka could work, unfortunately it doesn't contain enough alcohol to be effective. Myth number 3, the virus can survive on surfaces for up to a month. This is highly unlikely. Take research on other strains of coronavirus like SARS or MERS. It shows that viruses can remain infectious on hard surfaces like metal, glass or plastic from about 2 hours up to a maximum of 9 days. But the UK government says the risk of contamination is likely to be reduced significantly after 72 hours. Myth number 4, cow urine. Some Hindu groups in India believe cow urine has medicinal properties and can ward off coronavirus and other diseases. Not so, say the experts. Cow urine doesn't cure things like cancer, and there's no evidence at all that it can prevent COVID-19. You're better off simply washing your hands.
Wash your hands often with soap and water for at least 20 seconds. You can also use hand sanitizer that contains at least 60% alcohol. Take extra measures to put distance between yourself and others. Avoid close contact with people who are sick. Stay home if you're sick, except to get medical care. If you have severe symptoms, please call 911. Cover coughs and sneezes with a tissue or the inside of your elbow. Only wear a face mask if you're sick and around other people, or if you need to take care of someone who is sick. Clean and disinfect frequently touched surfaces. Older adults and people who have severe chronic medical conditions, like heart or lung disease or diabetes, are at higher risk for more serious illness from COVID-19. This group should consult with their healthcare provider about additional steps to